Okay, well, welcome back to another episode of The Hungry IMG. My name is Christina. I am a Filipino IMG, and today we have a very amazing guest joining us. I'm very thankful to have him grace this channel because he actually is in the middle of a case right now. But we were lucky enough to kind of get Dr. Soriano join us today. So welcome, Dr. Ian Soriano, another Filipino IMG.
Hi, Christina. Thanks. Good afternoon to everyone watching Christina's channel. Point of clarification, I was just helping a colleague who is in the middle of a case. I am not directly involved in the case myself. So I was just here helping him out, but I am not needed at that case anymore. So I'm glad that we were able to find the time. And looking forward to answering everyone's questions as well as hopefully inspiring and providing some guidance to other IMGs who are applying to this coming match as well as future matches.
Yeah, there are actually a bunch of Filipino IMGs who have reached out to me even before we, did this interview, who were a little hesitant to apply to, competitive specialties, like the one you're in. But we're gonna, bookmark that and talk about that a little later. Before we kind of get into the nitty gritty of things, can you tell everybody that's watching a little bit about your background and where you are now in your career?
Sure. So I finished med school at the University of the Philippines College of Medicine, and there was actually a question that was sent in that email you sent over that asked about University of Northern Philippines. I think that was, they probably found that on the American College of Surgeons website, which I actually corrected and emailed them because they had that wrong information. So I did go to UP. I finished in 1997 and part of the intermed class at that time. And then I came to the US in 99, actually probably 98 to study for the MLE. So I did take the MLE after med school, after passing the Philippine licensure exam.
Mhm.
And then after passing step one and step two, I applied for the 1999 match, which just goes to show how old I am. It was not even the year 2000. During that application period, I did not get a single interview. And I think it's important for this to talk not just about successes, but also challenges,
Right.
opportunities, and how to rise up from those challenges. I did not get a single interview, so I then took a job as a research coordinator at Mount Sinai. I think one of the advantages I had was that I already had a green card at that time. So
Mm.
if you look at the applications between US grads, I mean US citizens or US uh, or applicants with visas, it is also there's a difference in
Right.
how they match. Uh, a year after I was doing research, I then applied for the match again. I got the two interviews, one in surgery and one in medicine. And again, I did not match. But then since I was already doing research at a hospital that had a residency program, they then gave me a spot as a preliminary resident.
Mm.
And this was at Mount Sinai, so I was an intern at Mount Sinai in 2000. And then when I applied for the 2001 match as a categorical,
Mm.
again, I did not match. And I think this is very important that this then led to me at that point being offered a spot as a categorical resident outside the match, which is, I think it's called the SOAP now, or the
Right.
supplementary offer. Back
Yes.
then it was called the scramble,
Oh,
because
wow.
literally what happened is once you got the results of the available spots, you scrambled for a
Mm.
spot, like faxing, like sending by fax, which people don't probably even don't know what that is anymore. It's just sending your papers by fax, making phone calls, and then hoping that they get your application, and you wait for the phone call. Uh, from then, I then started as a categorical surgery resident at Einstein Medical Center in Philadelphia. I was at Mount Sinai for the past 2 years before that, where I finished my chief residency, and then subsequently did a minimally invasive surgery fellowship at
Mhm.
Cleveland Clinic in Florida. Following that, I also took the boards that year, and then did a year in private practice from 2007 to 2008 before, and then realizing that I enjoyed or missed being around residents and being around students. And so I then was recruited to Temple University Hospital, where I started in 2008 until 2011. At Temple, I was the associate director for bariatric surgery. And then from there, I was actually recruited back to where I did my residency at the Einstein Medical Center, where I joined from 2012 to 2015, prior to being recruited here to the University of Pennsylvania Health System as a surgeon based at Pennsylvania Hospital. And about 2 years ago, was promoted to associate professor, as well as named as the section chief for gastrointestinal surgery at Pennsylvania Hospital, which is actually the first hospital in the United States founded by Benjamin Franklin in 1751. So that is where I am as of now, but that ends next week when I leave Philadelphia, where I've been for the last 20 years, and move to the West Coast to start as faculty at the University of California, San Francisco, and also be what's called a surgeon champion for the National Surgical Quality and Improvement Program, which focuses on improving surgical quality for all the patients within, as advocated by the American College of Surgeons. So that has been my 24-year journey since med school.
Huge congratulations, first and foremost, to you about to transition to a new job, new state, new position. It's so exciting, and I'm so happy that you even, we have a lot to unpack with from what you just like told us. You gave us like a brief summary of what you've been through, but it sounds like even at the very beginning, and I know this is pretty much like one of the problems that a lot of IMGs face is when they don't match the first time, they kind of give up on the dream of pursuing residency. So before I kind of ask you more questions about your journey and whatnot, I wanted to ask, since you mentioned that you tried several times to match, and that whole process really did feel like a scramble after having to like go through the process again and trying to like match and all that. What was your mindset at the time when you felt when you didn't match? How did you deal with not matching? Was there a thought in your head where you said to yourself, I'm probably just going to go back to the Philippines and practice there? Tell us a little bit about that.
So certainly that was one of the thoughts that entered my mind when I didn't match. But I think that one of the things I did not mention was that I applied for a surgical residency at the Philippine General Hospital and
Okay.
was not offered a spot because during my year, it was a very competitive year,
Mm.
as it was actually getting harder to enter residency in the United States. Prior to that, there were actually direct recruitments at UP by certain residency programs in the United States. So I think at that point, I was just really, for lack of a better word, determined
Mhm.
that, I had to make it here. And, sometimes luck favors the prepared. So I set myself up uh, knowing that by not matching, one of the things that I definitely knew I was lacking in my application was clinical experience. And so I knew that I had to get myself in front of uh, US faculty in order
Right.
to be able to obtain letters of recommendation that would attest to, you know, my character, my work ethic, and all of these things that, you know, US programs are looking for that they can't or usually don't uh, make a judgment on if the letters or the references are not from US-based physicians.
Right.
And
How?
that's why getting into a research position
Yes.
was very.
Right. And would you say that that experience of you as a research coordinator was a pivotal like moment in your life and kind of made it even not easier, but made you a better candidate the next time you did apply?
So I was also lucky, and again, like I said, it's always lucky favors the prepared, or better be lucky than good sometimes. One of my classmates from med school was actually in that position
Oh, wow.
as a clinical research coordinator at Mount Sinai. And during his time as a coordinator, he was able to get an interview in pediatrics and subsequently matched into pediatrics within the same health system. And so as he was leaving, he then we were already talking at that time, and he mentioned that, hey, I'm leaving. There's an opening here. You should apply, and it's something that will certainly help your application. And so again, timing worked out perfectly.
Mhm.
I had to move to New York. I was in California at that time, but it was the right move to do.
That's amazing. And you know, I'm always curious to know, especially when I talk to IMGs who come on, you know, this series, what, based on your experience so far, because you've been through a lot, how would you compare the healthcare system in the Philippines versus what you've experienced here in the US?
I think from the healthcare standpoint, we know that the differences are more pronounced in the outlying rural areas. If you
Mhm.
go to Metro Manila, there's probably a lot of comparable experiences for patients, but a lot of it, as we know, is based on a person's financial capacity in the Philippines.
Right.
The big difference, obviously, is here the presence of insurance coverage, which again, that's going to be a very long discussion that I don't want to get into with, being a work-based insurance versus Medicare and all the other uh, ways to have healthcare coverage in the United States. It boils down to, there's a good chunk of Americans who have access to healthcare either through Medicare, Medicaid, or commercial insurers, as opposed to in the Philippines where it is predominantly a out-of-pocket expense with some coverage provided more recently by PhilHealth. So that is one big difference. I think the bigger or more important distinction is training, and I am sure we'll get into that later. But certainly there are differences. I'm not saying one's better than the other. I'm just saying that there are differences, and I think those are very important.
Absolutely. And I want to kind of go through a couple of the questions that were sent in by my followers. This one in particular is a really interesting one. Did you have to deal with a constant sense of anxiety or imposter syndrome about the future, especially as an IMG um, in that year? Even not having social media to look at, not knowing or not being able to reach out to mentors through, you know, Twitter, Instagram, Facebook, wherever, email, you know, were you going through, did you have bouts of anxiety, self-doubt, and all of those things?
I think it was probably better that I did not have social media back then, because really you relied on directly communicating with people whom you knew their phone number or knew their email. And so it made it, it was a smaller network, but at the same time, that network was, I would say, more meaningful because it is someone you had already developed relationships with. I think the imposter syndrome is actually bigger now as
Mhm.
I, uh, move clearly up in academia, going from coming from a community program, which is what Einstein is. It's a community-based residency program, to entering, residence to being on faculty, first at Temple and then Jefferson, which is part of Einstein, and then Penn, which is an Ivy League institution and one of the top 20 hospitals in the United States. And then from there, moving on next month to UCSF, which is in the top 10 health systems in the United States, the imposter syndrome actually gets almost worse in a sense, because you're always thinking, why am I here? But then you realize, if you look at what you've done the last, more recently, it shows that you have been progressing as well in how you've been career-wise.
I like how you brought up social media and how much more difficult it is now, especially if you are in medicine and an IMG, because it's so easy to compare yourself. And when you're seeing what everybody's doing, how far, a colleague's progressed in their career and you're kind of still stuck. That's a huge point to bring up because we're all on our phones. No, thanks to COVID. I personally will admit that it was harder for me to kind of move forward with my USMLE process at different points in time because of social media, and I felt very overwhelmed, very pressured, very anxious. So yeah, that's definitely a prevalent issue now in our generation, and everybody else who does have social access to social media. You mentioned the word networking earlier, Dr. Soriano. I wanted to ask, how important was mentorship or the connections you made during your process and in your USMLE journey, and how did it kind of contribute?
So one of the things that I think is very important as you go into the process of applying and then moving through the match and hopefully matching and then residency is to always treasure and make meaningful relationships with people who have succeeded in the field, as well as your colleagues or future colleagues, because they can be the source of both inspiration as well as challenge. Uh, the first person who mentored me as to go into surgery is now on the board of PhilHealth. He was the former executive vice president of UP, Dr. Teodoro Herbosa, Ted Herbosa. And he was the one who, actually one of the people who encouraged me to go to the US and apply for residency here from the Philippines. And I stay in touch with him to this day. We message each other on Facebook Messenger. We talk at least once or twice a year. And whenever I'm in the Philippines, I talk to him. When I came to the United States, one of my first mentors was Juan Asensio, who at that time was chief of trauma at USC, who is now the chair of surgery at Creighton University, and I still stay in touch with him. Just 2 weeks ago, I had coffee with my former chairman at Einstein, and he is 87. He is a retired surgeon for the last 10 years, but I at least call him probably every 3 or 4 months, check on him, make sure he's doing well. So maintain those important relationships for people who have, been with you or seen you through the challenges, and not just the ones who are your mentors, but also your colleagues.
Right.
I keep an ongoing text thread with my co-residents from residency 20 years ago, and I remind them where people are and what people are doing, and just to try to stay in touch. So
That's
it's very important to
amazing.
have those connections.
Yeah, and I think highlighting mentorship and connections is important for IMGs because if you are a non-US IMG who's coming here without relatives, any friends, especially in the medical field, it's very hard to feel confident about your chances of matching. Um, there are so many wonderful people on social media now in the healthcare, like who are physicians who are more than willing to kind of mentor people who are going through that process. I'm curious to know, you mentioned, how you keep a message thread with your co-residents. I want to talk a little bit about your former co-residents. I want to talk a little bit about residency and how you got there. So was research a big part of, the requirements in surgery at that time?
So I wouldn't say they're required. All right. I would say that uh, it would help your application. But I think more than that, so as a clinical research coordinator, I actually was not publishing any research.
Mhm.
I was helping primary investigators keep track of their patients who were enrolled in studies. It was filing data and working closely with primary investigators who were conducting clinical studies at that time. That was the role of a clinical research coordinator. And so, more than anything, it was developing a close relationship with a US based physician, whether an internist or a surgeon. Since I was doing, it was transplant surgery at that time, I was working with uh, transplant nephrologists, transplant gastroenterologists, as well as transplant surgeons. And so it was, I was right in their offices at the end of the day and talking about research patients and how we could, recruit patients, how we could make the study better, and things like that. So
Mhm.
uh, I would also add to that from my experience now being on the admissions committee at Penn, being part of the group that screens applicants for who are applying for residency, that we do look at their research experience.
Mhm.
We look, but not just the number, but actually the significance of the papers that are written. But
Right.
then we also understand that the journey of an non-US IMG to be able to actually publish something is actually a more circuitous route
Mhm.
than a US based student. And so we understand the challenges involved in publishing for a non-US IMG, and also take that into consideration as part of our holistic evaluation process, which is something that more and more programs are doing.
Which is wonderful because I think, like you mentioned, IMGs tend to focus so much on the USMLE step scores that we forget to kind of give importance to things like research and probably working closely with an attending, whether that be in the form of a research coordinator position, a medical scribe position, things along that line. Since you've experienced being on the other side of the process, Dr. Soriano, what would you consider are like quality letters of recommendations? And is this something that carries weight when an applicant is trying to match into surgery?
So I'll speak from both my experience as well as if you look at the NRMP that just recently published actually a summary of what program directors
Look for.
ranked as their top characteristics of an applicant
Mhm.
to be offered an interview. And then they also rank the top characteristics of offering a position once they've been interviewed. And because they are very distinct. The first gets you into the door, and then the second part gets you invited to stay in and have dinner, right? So I think to get in the door, uh, the challenge I think moving forward is that this is the last year that step one is going to be not a pass fail.
Yes.
Uh, and so step two will probably play a bigger role moving forward because it is unfortunately still used as a screening, I believe, by most programs for non US grads, both MDs and DOs, as a screen. And if you look at the scores for the average scores for IMGs, US IMGs typically have a slightly lower score than the non-US IMGs who match, and probably that accounts for some of the challenges with finding a match. So the things that are important uh, when looking at application is did they have the opportunity to work with a US based physician who has then written a very strong letter of support. Uh, and in that letter, what we look at are, is that person a hard worker? Is that
Right.
person reliable? Things that speak of character. And that is very important because the scores already sort of tell us how smart a person is and whether they will do well in a competitive field. But we're really looking at candidates who have the character, the grit, the determination to get through uh, and succeed in a highly competitive field. And there are probably more opportunities for IMGs at uh, like community or hybrid programs. uh, Academic programs do consider IMGs as well, and that's important to know. But it definitely is going to be a more challenging uphill climb to get into an academic program. Although last couple of years we'd have a couple of graduates here at Penn who are started out as one of our preliminary IMGs.
That's incredible. And since we're on the subject of, IMGs having to get into residency, especially in competitive specialties as like surgery, from your experience, there's a question that came in or that like was sent in and asked, what are the best IMG friendly cities or places for surgical specialties?
I'd say it's not the city, but it's more the size of the program and as well as the
Okay.
number of hospitals in that area. Because I know of people who have matched, all over the place, whether it's down south in Florida, up in Chicago, east in New York and Philadelphia, or in the Midwest. I mean, you can pretty much, I think, uh, if you send an application to a program that historically has accepted IMGs, and these are mostly community programs, although, like I said, non, I've seen IMGs match at university places. Usually you start off matching at a university program as a preliminary and then move on as a categorical, or at least it increases your likelihood of getting a categorical position afterwards. Not necessarily at that university place, but increases your chances at other programs. Uh, and I've actually seen some of our candidates do that. Had one of our prelims last year or 2 years ago. He's now a categorical at a huge program in Pennsylvania. And remember that at the end of the day, it's not training at a huge academic place. It's actually getting a categorical residency spot, finishing the residency, and then either practicing or entering a fellowship. And once you get into residency, getting the fellowship afterwards is typically an easier hurdle to get through.
And for those who are hearing the words categorical and preliminary for the very first time, can you kind of give us a brief like description of what the difference is between the two?
Sure. So we have to go back even maybe 20, 30 years. It used to be that certain surgical specialties were a pyramidal system. So what happens is at the base, when you come in, they hire 10 people, and then every year they get rid of, or they only advance a certain number of residents.
Right.
So the program starts up with 10, becomes 8, becomes 6, and then by the time people finish, there are only 4 graduating chief residents. It was decided maybe about 20, 30 years ago that that was probably not a good system for multiple reasons. And so they then instituted having a categorical and a preliminary position. So a categorical position essentially means that a resident is guaranteed that position to enter and finish that residency program. So if it's whether it's medicine, surgery, psych, you come in as an intern, and then you progress until the last year of that training program. And for the most part, it's guaranteed that you will finish without having to look for another position. If you are a preliminary resident, there's 2 types. You have designated and non-designated preliminary residents. Designated preliminary residents are residents who have been accepted into a second year position, typically radiology, interventional radiology, some specialties. or urology and things like that. But then they need to do a year in either medicine or surgery as a preliminary resident. So even though they're preliminary, they already have a designated second year spot.
Right.
A non-designated preliminary resident is a resident who is accepted in a program with no guarantees
Mm.
that they will have any place to go to afterwards. Although more and more the NRMP is looking into the number of spots offered and trying to encourage that the non-designated preliminaries be given a reasonable chance of matching at a spot later on, either as a first year resident again, or sometimes even as a second year resident.
Right. So, since we're still on the subject of residency, in your opinion, what characteristics should a resident have, as well as the program, in order to have a successful residency training in surgery, in particular?
All right, so yeah, because it's going to be hard for me to speak for other residency programs. I think in this day and age, to enter a surgical residency, you definitely need to work hard. And I think it actually applies to all residency programs. You need to work hard. You need to be dedicated and focused on that specialty because it does happen sometimes that some applicants start up with this interest and then get become unsure in the middle of it and then leave, and that spot then becomes a challenge to fill sometimes for the program. So you need to have that commitment. You need to be able to have great relationships or know how to create great relationships with the people you work with. You have to be part of a team, and that applies to, I think that applies to all residencies, because we more and more we're becoming a collaborative. We can't manage patients on our own. We're always working with medicine. We're always working with GYN. We're consulting psych. I mean, you need to be able to work well with others. I think it's important to know that for no residency position or no resident is better than another. I sometimes hear others say like, "Oh, that's just psych. That's just family medicine." That's
Right.
not. Everyone is an important part of taking care of a patient, and so each residency uh, spot you apply to, whether it's internal medicine, surgery, or whatever, they all play a role in taking care of the patient. And so everyone needs to work well with each other. So I think that's a very important characteristic, and not, putting any other person down. So I think that is very important. On the part of the residency program itself, I think it's the same thing. You need to, it's important to be in a program that is supportive of its applicants,
Yes.
that values an app or a resident's overall well-being.
Yes.
It used to be that we got less than a week of paternity leave as residents, but now more and more. Just recently, the American College of Surgeons, American Board of Surgery, and other societies are now really stressing the importance of wellness. Like bullying, I definitely experienced that as a resident, but I think more and more now there is a supportive environment, and I think that is key. And I think that it's going to be harder for programs that are malignant, so to speak, to have a successful match, because word really does get around if a program is malignant. So I think more and more programs understand the importance of having an overall wellness program for the residents.
Yeah, and because okay, so the buzzword for me was bullying in what you just said, Dr. Soriano. So in the Philippines, when I was an intern, there's definitely, even as a medical student, there's definitely a lot of cases, and I talk openly about this on social media as well, about how bullying is very prevalent in the healthcare system in the Philippines. And I found out that even in countries like Middle Eastern countries, people on Instagram would kind of message me and tell me their experiences. But on that note, like I wanted to know if it's okay for you to kind of talk a little bit about bullying as an experience that you had in residency and how you handled it, because in the Philippines, if you kind of bring up these grievances to your superior, there's a chance that they won't take it the right way and kind of like throw it
Yeah.
back at you. So curious to know, and I have a follow-up question after this, but I just want to know what your
I think
experience was
the
like.
better term actually, and not bullying, is a very deep ingrained culture of seniority more than anything, where everyone is supposed to have their place within that training
Hierarchy,
pyramid.
right?
Yeah, there is a
Right.
hierarchy. And so you got the attending, you got the chief and the attending, and then chief resident, fourth year resident, junior resident, intern, medical student. And certainly that I think is cultural wherever you go. And
Right.
whether that's in Asia or in the Middle East or in the United States, I think a lot of that had to do with uh, the culture of maintaining that hierarchy, where the older one was or is, or the more training they had, the more people looked up to them, and it also gave them the license to say whatever and do whatever. I think that, over the last 5 years or maybe 10 years even, we're now recognizing the importance of leveling the field, and uh, even for juniors to not necessarily question, but to have a more level discussion of how a patient is managed, how people are treated in the OR, and things like that. Certainly, it was not consistent. I think that during residency, there were certainly, senior residents and attendings whom I could go up to them as an intern and say, "Hey, I disagree with what you're saying, and here's the evidence of why I think we should do this." And you could have that discussion, as opposed to in other cultures where whatever the attending said had to be followed, and their word was, the word was the law. I think that we are recognizing now that uh, giving everyone a safe space to express, what their thoughts are, to express their opinions, leads to better patient care.
Right.
And this is not just within that educational uh, pyramid, but also the people around us in our other partners in healthcare. And I say partners in healthcare, I refer to, our nurses, refer to everyone else whom we work with, the occupational therapists, the pharmacists. They are all valuable members of the healthcare team, and it is important. And they know more than we do when it comes to pharmacy, to drugs and medications. They know more than we do about rehab and whether patients safe to go home from the hospital. And so we need to value all those members of the healthcare team, and because we can't do everything. And so they are
Absolutely.
very important. The nurses are at the patient's bedside 24/7. We can't be. So they know the patient more than we do. So it is very important that we respect every member of the healthcare team. And I think that is becoming the predominant attitude now across the healthcare system.
Absolutely. And similarly, there was a question that asked something about whether or not you've experienced discrimination as a Filipino during your training, or whether it was from a colleague, or a patient. Can you tell us a little bit about that?
Sure. I think that, you know, uh, there's certainly microaggressions
Mhm.
or micro discriminations, I would say. Just hearing someone say, "Oh, you speak English really well,"
Right.
that's a microaggression that
Yeah.
is, happens quite often.
Hmm.
Uh, or, "Oh, you look so young. How long have you been in practice?" Just things like that. So certainly have experienced that over the last 20 years, from residency to this day. Uh, you
Hmm.
know, and how I react to it. There are multiple ways that you can handle that. You could always say, well, I think what happens is we then try to deflect, or we try to lighten up the situation. But I think more and more people are recognizing that these are microaggressions, and it
Mhm.
is important to call it out in a way. But that also depends on what your relationship is
Right.
with that person. One of the things I'm really excited about with joining UCSF is just last week I did 7 hours of training on diversity, equity, and inclusion,
Mm.
talking about microaggressions, talking about uh, how to handle, bias in the workplace, also
Yes.
recognizing my own privileges and biases at this point. And I think what's important is knowing that we do have our privileges, we do have our biases, but then there's all people also have those uh, against me or against us, but handling it in a way that elevates the discussion rather than making it more difficult, or uh, making the environment more uh, uh, making the environment better than making the environment worse is the better way of handling it, but not ignoring it.
Yes. Absolutely. And I think I was so intrigued that this question came up because it came from a Filipina, and I like how these questions are now being asked because when I did a rotation in Chicago in August for a month, I met up with a bunch of other, Filipino IMGs, and one of them had told me that she was scared to kind of go through with residency here in the States because she was scared about, being discriminated. And I've also experienced microaggressions, like you mentioned, both in the hospital and even places like church, the grocery, things like that. And it's very hard because sometimes you get caught off guard and you don't want to sound rude. Sometimes you don't know what to say, you just kind of ignore it. But then later on, you come home and you kind of sit with it, and then you just like, that's the only time you realize that it was a microaggression,
Mhm.
which is so interesting to experience as somebody who was raised in the Philippines. But I'm glad you shared that with us, and how you are also an advocate for diversity, equity, and inclusion, or at least like are learning more about it. It's definitely not something that we're exposed to in the Philippines. So
Actually, you'd be surprised. I think we just don't acknowledge it as microaggressions. But in the Philippines, I do bariatric surgery.
Mhm.
In the Philippines, it's always a joke when someone says, talks about weight, talks about skin
Yes,
color. In the
yes,
Philippines, lighter skinned Filipinos and darker skinned Filipinos, those are microaggressions that are just relegated as jokes in the Philippines, but
right,
they are microaggressions.
yeah,
We have to admit the fact that glutathione
yes,
is something that a lot that is being heavily marketed, tells us that why can't we value a darker skinned Filipino's
yeah,
natural skin color? So I think it is
exactly.
very important that it actually does happen in the Philippines, but but because of the extremes that we see, with Caucasians and blacks, and then you've got the brown people in between, and then also obviously the different Asian populations, the different South American countries. We don't realize that in the Philippines, among Filipinos, we actually have a lot of microaggressions
Oh
against
my
each other.
gosh.
We
Yeah.
just don't acknowledge it.
That's true. We definitely don't put a label to what we're doing, but we do it all the time. My mom and I would joke about how, it's just, we like to brush things off as Filipinos and then kind of mask it as a joke. But really, I don't know. For personally, I've never found those jokes funny, especially when they come off as like personal attacks, but then are followed up with like laughter and things like that. But yeah, definitely agree with you on that. There are microaggressions that we are very much guilty of in the Philippines, just not labeled.
Correct. Correct.
Yeah. This one is an interesting question. I was curious to know the answer as well. Somebody had asked, in the Philippines, there's an age limit around 35 years old for surgery applicants. Is there one in the US?
Not that I know of officially. I can tell you that when I was an intern at Mount Sinai, two of my co-interns were probably about 40.
Mhm.
One was a microvascular surgeon
Wow.
from Russia who was practicing for about 15, 20 years. So he was well above the age of 40, and he was one of my co-interns. And then, there's another one who was an anesthesiologist from Israel. And so ageism is certainly not something that is uh, uh, a factor, I think, in accepting applicants for residency, or older age limits are not placed. But it certainly, I guess, is going to be a challenge
Right.
going through residency training again. But I can tell you that, having worked with them, they were some of your best resources because they could handle anything and they knew everything. So I don't know of any official age limit,
Right.
and I don't think there should be.
I agree. I really hope that that should be like the mindset of most programs, because a lot of IMGs especially are coming from their home countries and have just finished residency or are already attendings. They have families of their own. And speaking of families, Dr. Soriano, you are a dad. I noticed that on your Twitter bio. I'm curious because a lot of the times people hesitate to go into something as competitive as surgery for fear of not having time for their family or their kids. How do you strike a, not sure if balance is the right word, or compromise when it comes to like family and work?
So, I think the term work-life balance does not exist or is appropriate. I think the right term is just, you know, selective prioritization. It's no, it's, when you're working, but then when you go home from work, you shouldn't bring your work home and then
Right.
focus on the people you're with. So it's making meaningful moments where you're at. Because if you come home and you bring your work home and not make you know create meaningful time with your family, your kids, then it's not work, and then you're not making the time to be successful at home as well. If you want to be successful at work, you have to be successful at home as well, and that includes working for your personal relationships and making that work as well. And certainly has been a challenge for me. I'm not saying it's easy, uh, but I think we all know that anything we want to be successful at, we have to work for, and that includes our personal life, and that includes
Definitely.
our health as well.
Oh
A
yeah.
lot of residents forget to take care of themselves. A lot of people gain weight during residency. A lot of people suffer from depression during residency. And that's why it's important to maintain our physical as well as our mental health during this process, either before, during the application process, during, and afterwards. There's a high rate of suicides among physicians. There have been instances of residents dropping out of training due to depression, and I think a lot of programs are recognizing now that you don't have to make it any harder than it is in providing support necessary uh, during training as well as afterwards.
Yeah, I think one of the things that really drew me to pursuing residency here in the US is when you're looking at various websites, residency program websites, you will see some of the services or at least like the benefits of being part of that team. So things like counseling and paid leave time where you don't really have to struggle to kind of ask for leave. I know for a fact that when my brother was a surgical resident in the Philippines, he struggled so much to kind of get leave. And it was almost to the point where he really had to beg for leave. And it's so different here because it's something that they actually will encourage you to have and actually set time aside for that. So definitely a huge part. Wellness, residency wellness is definitely a huge thing to consider. I want to kind of wrap it up a little bit and ask you, Dr. Soriano, advice for people who, well, non-US IMGs or IMGs in general, who want to pursue competitive specialties, not just surgery, but maybe OBGYN and things like that. What would you want to kind of tell IMGs?
So my words of advice are, make meaningful, create meaningful relationships with people who can mentor you, and advise you on how to strengthen your application. Certainly having some clinical and research experience, it will definitely help, especially as there are more and more applicants now. The number of IMG applicants, I believe this year was 8,000, no, or maybe 15,000. It's grown significantly, although it's plateaued the last 3 years, based on NRMP. But it is definitely getting more challenging. So the way to stand out is really to have some significant research and clinical experience, but more than that is that they should be meaningful enough that the people you work with will write you a letter of recommendation. I think that is the bottom line. And those people are the ones who will be your mentors. Because more than anything, someone who can speak to your character, to your work ethic, to your reliability, to your honesty is what will matter. And so it goes back to, again, relationships, but then those relationships then produce the things that help your application, research, clinical, letters of recommendation.
Absolutely. Mentorship should be stressed more, because people forget. I think they focus more on step scores, like we talked about earlier, and completely forget about mentorship. And there's one more question. I think I should have started with this, but why surgery?
I am a very impatient person. So I can't imagine taking care of a patient and waiting 3 months for a drug to work, or for I just can't. I need instant gratification. And so, although it's funny, bariatric surgery, you don't get instant gratification,
Right.
but it is a lifelong improvement of the patient who is suffering from obesity. So I think that was one reason. The second would be, and it's a typical story, but I do think that being able to directly do something with my hands, it was something that I found fascination with. I don't know if this is going to be going back now to stereotypes, but I play the piano, I play the drums, I play the bass guitar, or used to at least, and so I guess the combination of being a manual person, plus wanting results that you could directly have a hand in, is what drove me to the specialty. And then choosing minimally invasive surgery back in '99, it was a relatively new subspecialty. Back in 2007 when I applied. I'm sorry, 2006 when I applied. And so I think at that time I really wanted to be at the forefront of something that was new, being able to have patients recover quicker, go to work quicker, being able to do huge operations with small incisions, and then now with robotics is what drove me to this subspecialty of general surgery.
That's amazing. I'm definitely in awe of, especially a Filipino. You make me so proud, Dr. Soriano. You are a Filipino surgeon here in the US, and that's why I was really excited to talk to you. And so, Yeah, I will make sure to leave your, I know you have an Instagram now and your Twitter as well. I will leave in the description box. But yes, that pretty much wraps up today's episode, Dr. Soriano. I really appreciate you taking the time to chat with me and share all of your experiences and all your tips and advice. Will you be open to people kind of reaching out to you on Instagram and Twitter and things like that? And I know we talked about mentorship here, and I'm pretty sure a lot of IMGs will want to like reach out to you and like ask you more questions.
Sure. I mean, obviously you have my Instagram and Twitter account. I think I was funny. I was just reading about this today. Someone posted that, you know, when you're doing that, also be mindful that we may not be able to answer right away because there might be,
Yes.
like, we almost had to reschedule our meeting because I was in the OR helping
Yes.
out a colleague. Yes, I am a lot of IMG physicians who are now in practice are certainly willing to be mentors, but we also have obviously other responsibilities
Yes.
and other duties that we have to do. So we may not be able to answer right away. But I think it's also important to pick the right mentor.
Yes.
You want to pick someone who can definitely, uh, be you can develop a personal relationship with that can then really not just be a mentor, but even an ally or a sponsor and moving you forward. Uh, I probably will not be a good mentor for someone who's applying to internal medicine, psych, pediatrics probably be a better mentor for someone who is thinking of applying to general surgery and who
Yes.
already does have some sort of uh, uh, qualifications to move their application forward, because it's going to be hard to have that relationship if someone hasn't even taken their steps or
Yes.
hasn't, so know when the right time is to reach out
Yes.
someone as well, because you want to be respectful of their time and the energy that they will provide for you.
You guys heard it straight from Dr. Soriano. I try to emphasize this as much as I can on social media, especially that you cannot bombard people on social media with so many messages just because they don't respond right away. Everybody's busy. Like you said, Dr. Soriano, everybody has like other responsibilities. You are not the focus of, their job, career, all that stuff. But yeah, be mindful, be sensitive of a potential mentor's time and responses and the way you speak to them. So yeah, again, thank you so much for your time, Dr. Soriano. It was such a pleasure to have you.
Thanks, Christina. It was a pleasure. And just to add to what you said earlier, there are actually a lot of other Filipinos and non-Filipinos who have been successful or have been, are now in the academic realm in surgery. And so, it's not, I think the take-home message from me is that it is not impossible. It is certainly
Mhm.
doable, but it certainly requires a lot of hard work, a lot of commitment and grit. Really, you
Grit.
need to be able to, keep your head above water when things are not going well
Yes.
and seeing yourself through the challenges.
Absolutely. I agree with you 100%. Thank you again for your time. I will make sure to, guys, please follow Dr. Soriano and keep up with like his, journey as well, because it's still about to transition to like a new chapter of his life, which I'm so excited for. And again, congratulations. And yeah, I will see you guys in the next episode. Thank you.
Have a good day. Thanks, everyone. Thanks,
Bye.
Christina.
Of
Bye bye.
course.